Thank you very much. So good morning, everyone. Welcome to the January 21st, 2020 Joint Boards of Health and Hospitals meeting. Thank you for attending. I would like to call the meeting to order. Thank you, board members, for showing up, and for our guests and other speakers. Thank you. And I do believe we have a quorum, so I'm going to proceed. Next agenda item is the approval of the Zoom video from January 7th, 2021. So since our meetings are recorded, we are approving minutes via recording of the Zoom video. May I have a second to approve the previous Zoom video recording?
Second it.
Thank you. May I have counts for approval of the minutes? Anyone against?
Yes, approve.
Aye.
Approve.
Approve.
Thank you. Anyone against approving the minutes from the previous meeting? All right, motion approved. So our minutes are approved for January 7th, 2021. And we will move to the next agenda item. We have a lot to talk about today, folks, including relationships with our school and educational partners and vaccine distribution and some policy discussions. So we are going to get moving through the agenda. And I'm going to pass the Zoom mic to Dr. Eccles to talk about our COVID-19 update in St. Louis City. Dr. Eccles.
Great. Thank you, Dr. Baloo. This year has been eventful already, as I'm sure all of you are aware. The good thing is that the surge that we anticipated occurring after the holiday season, we really didn't get that in the city of St. Louis. And a lot of that is due to a lot of the education and education efforts and outreach efforts that we did with the community, reminding them of the requirements in the city of St. Louis, but also we kind of changed our approach as well because we wanted individuals to see or view the mitigation measures as an act of compassion, not only for themselves, but for their families and loved ones. And so we think most individuals actually heeded to that. And so due to that, we didn't have a huge surge in the city of St. Louis. When we look at the 14-day trajectory in the city of St. Louis, we've had a 34.5% reduction in the average of new cases. So right now we're averaging roughly 73 new cases per day, which is, again, I believe the lowest in the region as well. When we look at the case counts for the region, the city of St. Louis also has the lowest number of confirmed COVID-19 cases in the region. And so a lot of that is due to the outreach and education efforts, but also community adhering to the mitigation measures that we've recommended. And we've also have some great partners that we're working with, and some of them are on this call today. And so we're really grateful for the partnerships that have evolved over the course of this pandemic. Now, they've been extremely fruitful, and we're reaping the benefits of that. Testing was also a challenge for us during the holiday season. A lot of the federally qualified health centers and other agencies were not able to maintain a lot of the testing sites due to the holiday schedule. However, since the new year has begun, we have increased testing in the city of St. Louis, and testing has gone up since the holiday season, roughly around 20%. And so that's been really good to see that testing has increased. So the numbers that we're seeing reflect what's actually happening in our community. So we're grateful for that. The other thing is we're also looking at the percent positivity rate. So right now, over the last 14 days, we've had a reduction of almost 3% in the percent positivity in the city of St. Louis. We're hanging out around 11. Our goal is to be less than 10. Ideally, we'd be less than 5, but we'll take baby steps to get there. So right now, we're continuing our efforts to inform the community, work with our partners, and make sure that we're implementing the proper measures to control the spread of COVID-19 in our jurisdiction. So that's where we are from a data standpoint. For talk about testing, so vaccine distribution is the other major topic that is, I guess, on the forefront. So many of you all know that as of today, the City of St. Louis Department of Health, we haven't received our direct allocation of COVID-19 vaccine from the state, but it is in queue. But we're not alone in that. So I want people to know that the city of St. Louis isn't the only jurisdiction in the state that has not received vaccine. So Jefferson County also has not received vaccine, as well as several other jurisdictions. And so we're one in queue. Our hope is that we'll receive vaccine sometime next week. We're still waiting to get confirmation from the state, but as soon as that information is received, I'll definitely let the board know, and the mayor's office will also be informed. In the meantime, we are working with a lot of our partners across the city to leverage vaccine resources. So some of our first responders and EMS staff have begun to receive the COVID-19 vaccine. So a lot of them have received their first dose, and some of them will be in queue again next week when we receive our allocation from the state. But vaccine rollout is also a challenge. The supply remains insufficient to meet the demand in the community, even for groups 1A. And so although the state rolled out, the state moved from 1A to 1B on last Thursday, and then they moved to phase 2 on Monday. That was really concerning for us, knowing that there was insufficient vaccine even for the first priority group. And so that has led to a lot of contention across the local public health agencies, and that contention has been relayed to the state because we didn't feel like it was responsible to move forward without having proper coverage within the first priority group. But that's out of our control. And so what we continue to do as we wait for vaccine is make sure we're properly planning. So our public health emergency preparedness program is doing a phenomenal job working with agencies to secure information about those individuals who desire to receive the vaccine. So when the vaccine is received, we can have an efficient rollout. The vaccines that have been approved have really strict storage requirements. So the cold chain requirements are really can be a barrier if you don't plan properly. And so by working with a lot of the agencies across the city of St. Louis, we're actually getting all of our ducks in a row so we can have an efficient rollout. And that, again, that's important because when we receive vaccine, we want to make sure that we don't waste vaccine. If we receive vaccine and waste vaccine, that's a whole story that we don't want to tell, right? So we're getting all our ducks in a row, and we're working really closely with all our partners. We're also working with some of the large venues who have agreed to serve as community vaccination sites. And so we'll be planning hopefully some community vaccination sites, especially when the vaccine is, when we move to phase 3, when the vaccine is available to the general population, to make sure that we can provide as many doses of vaccine to our community as possible. There are some special groups that we're working more diligently to identify solutions for, and those are individuals who are homebound and who may not have the ability to actually go to a COVID-19 vaccination site or even to a medical provider. And so we're having discussions about what steps we can take to make sure those individuals are not left out, because they also deserve the opportunity to receive the COVID-19 vaccine. So as we work through a lot of these issues that we've identified, we'll relay those plans and so forth to the Board of Health as well as the Mayor's office.
So I have a question, and it's not a question, it's just a statement of a brewing concern in the community. A concern, Dr. Echols, what you mentioned is beyond our control. That is, a number of individuals have recognized that the county actually will receive their allotment of vaccines sooner than the city. In fact, I think there have been, in one instance, they actually may have received more doses. And so there already is talk of the inherent inequity in that, given the fact that the mortality has been significantly higher in the city, particularly in North St. Louis. And so we just need to get on top of that story and try to convey, as you just stated, that the issues of distribution are being guided by the state. So otherwise, we're going to have some major concerns and justifiable concerns if we can't get the state to develop a policy that really addresses the distribution based on need.
There is a coalition or a group that was formed by the state that's helping with policy development regarding equitable distribution. But again, that's just an advisory group, so they can heed to the recommendations or not. So far from what we've seen, I'm not sure if that's happening, but I do know that there's a group that's put in place to kind of advise the state on measures that actions that can be taken to ensure equitable distribution.
I see that Dr. McBride has a question.
Yeah, and I appreciate your comments, Dr. Eccles, too. And I think you clearly laid out some concerns around the vaccine, and I've been hearing a lot of those concerns as well as in reading them as well in the paper. And I think I just want to highlight those as well, so they're on the record, that it seems, just so we're clear that I think that a lot of the community is worried about the vaccine distribution, and there's a lot of angst about, when am I going to get the vaccine? And we're hearing there's a rollout from 1B to 2. And I just wanted to be stated just one more time that that's not a city board of health decision, that's a state decision. And that was done before the supply was available. And that's something that's not in your control. And so, and I remain quite concerned about that, as well as the distributional issues that Dr. Ross talked about. I think, I don't know what there is that we can do about that other than just to voice our concerns about it. But I think we have to be worried about what's going to go on in the community. But it seems there's just this is obviously not just a St. Louis problem. It's a Missouri problem. It's around the whole country. But this is a policy problem. But people are going to start asking. They're obviously already starting to ask about what's going on. And we have to be clear about what's going on. And then in the next few weeks, what can be done about this. And we have to be pretty clear to be fair and balanced about this.
Thank you, Dr. McBride. I've heard similar stories and concerns from community partners that don't necessarily have not been informed about how the supply chain works, and that the city cannot distribute until the state receives the vaccination, and perhaps there's even a backlog from the federal agencies and the state being able to give the vaccine to jurisdictions. But from a concern, that Dr. Ross mentioned earlier, that there is a lack of trust issue even among the first tier of employees and individuals that were eligible for shots, that they don't want to get them, that if we're not careful with messaging about, it's not the city holding back the vaccinations, the city is waiting for the state and ultimately from the federal government to receive the vaccinations, that we might miss individuals that are kind of on that fence for wanting to get vaccinated if we delay. So the delay might cause some folks that are hesitant to not get vaccinated. So we keep the messaging that about the time frame and about the state, so that the perception that the city is perhaps not rolling out the vaccine for some other reason than a backlog from the state, that it might exacerbate some of the trust and hesitance issues. So I think that the messaging needs to be pretty swift and consistent to not lose more individuals who are willing to get vaccinated.
And Dr. Blue, one thing that we also are mindful of is that there's still a lot of misinformation just in the among the general population. And so we continue to work with the Board of Aldermen and the neighborhood group associations. So when there's opportunities for us to provide information and connect them with accurate resources that have accurate information, we continue to do that. That's one of the reasons why we established the COVID-19 vaccines section on the health department's website. So, the community members could have a resource that they could at their fingertips that they could go to get information about the two vaccines that are currently available, as well as information and updates that are coming down from the federal government, whether it's the FDA or the NIH, that they need to be aware of. And so we want to make sure that we're doing our very best to continue to inform, make sure people are informed. Because I mentioned during one of the previous meetings, our purpose isn't to coerce or persuade individuals to do X, Y, and Z, but it's really to give them all the information they need to make an informed decision for their health and their family's health. And so that continues to be our approach, and we'll continue these efforts.
Thank you, Dr. Eccles. Are there any more questions or comments about vaccine distribution or ongoing testing?
I have a comment.
Yes.
So
yes.
One element that I think we also need to be clear about is that the hospital systems that already have infrastructure to distribute the vaccine have started to do outreach to their patients. So there's a lot of conversation in the community about the fact that if you have private insurance, if you're connected to a healthcare home, you have greater access than those who would traditionally rely on our federally qualified health centers or our health departments or other avenues for healthcare. So when we talk about equitable distribution, as long as the state has a plan or a system that allows everybody else to be covered by the health departments who have the least infrastructure, and then our university partners and our hospital partners are able to focus in on their own patients, that's going to continue to drive the inequity. So I think we need to also be having conversations with our hospital partners on how we can make sure that we're working together to make it accessible to as many people as possible, so that we're not just serving our own networks.
Thank you. Thank you for that comment. Dr. Eccles, are there any?
Dr. Manny, I think, wanted to speak.
Dr. Lashley.
Yeah, thank you. I couldn't agree more with us, with Serena, and I have a question and a comment. So my question is specifically, has the county received vaccine?
Yes.
Okay. So I think based on that, and with the fact that county has vaccine, the hospitals have already started rollout, and I think that Dr. Eccles, first of all, I want to be clear in saying that I commend you greatly for the work that you're doing with your hands tied behind your back to a certain degree. I don't believe that it is productive for us to focus on messaging that prescribes blame, but I do think it is a matter of urgency to be clear about our position on equity and our position and what our plan is once vaccine comes. As you know, I've been working very much on vaccine hesitancy and education within the community. And the sentiments that have been spoken about thus far by Dr. McBride, Dr. Ross, and Serena are all consistent with what folks are talking about. So some suggestions I would have is about positive reinforcement and people understanding that A, we don't have vaccine, but B, this is what our plan looks like when we do. And I think that kind of clear and consistent messaging would go a long way to endearing folks to trust, because the mistrust amongst government agencies is as high as amongst medical and scientific institutions. And I do not want the city to suffer because of what may be happening higher up. And so I know you talked about, the community, the communication focus right now being on arming folks with the information they need, but I would be interested in what your thoughts are about also a communication strategy around people understanding that we are not withholding from them, especially knowing that county has vaccine, for example, and other jurisdictions were given vaccine before us.
Right. So I think that's a great point. And in this seat, I'm not sure. So that's a very fine line. And so being mindful of the political implications is something that I have to be aware of as well. And so right now, by kind of sticking to the facts, which we've been doing through our media interviews, and so forth. We've been communicating that what you're talking about to the community, but we're just mindful about how we say it. And so because we have to, again, we have a lot of partners that we have to work with beyond COVID-19, and we want to make sure those partnerships remain in place because they are really critical in helping us lift the public health work. But to Serena's point, and Doctors Ross, Lashwell, and McBride, the equity is something that we have to be mindful of. So there could be a larger plan for the state, and then for our jurisdiction, making sure that we implement an equitable approach, or a health justice approach, is really critical. And so that's what we're dedicated to. When we issued our phased approach, which is also posted on the website, it includes equity as a part of that rollout. So making sure those populations who are disproportionately impacted by COVID-19 also have access at various stages throughout the vaccine distribution plan is really critical. And so we'll be sticking to that.
Thank you, Dr. Eccles, and I'd like to echo previous comments that we know that this is an incredibly difficult situation, and that the vaccine supply chain is not within your control. And thank you for staying the course and making sure that our community is safe from COVID. Are there any additional questions or comments from any of the attendees based on equitable distribution of vaccination, or any other comments or concerns about vaccine distribution? Thank you. Our next agenda item is an update on primary, secondary, and tertiary school partnerships with the City Department of Health, and that agenda item is also Dr. Eccles.
So this is I've talked a lot about what's happening in schools for the last few months. And so I felt that it was really important for us to receive information from the source. So we've been working really closely with primary, secondary, and tertiary academic institutions since the summer of last year, and they've been doing some really amazing work. Right now, school-age youth account for only 5.6% of the total number of COVID-19 cases reported in the city, and a lot of that is due to the fact that they have really sound operating and infection control plans that they've been implementing in their institutions. When we looked at the data or the information from the fall semester, there's really no evidence of transmission within the schools. And so what we found was, as I've told you all, there was a lot of exposures that occurred outside of the school setting. Because of those exposures, primarily, a lot of it was, some of it was adults. So if you have teachers that are exposed, that pulls them, and they get infected, that pulls them from the workforce, so that impacts the operations for the schools. But then also we have families that were gathering, and so the children were exposed, and so that pulls them from the school because they have to quarantine. So that's a lot what we saw during the fall, but I'm going to let them tell the story. And so we'll start with Jamie Driver, who is with the independent schools in the city of St. Louis.
Well, thank you, Dr. Eccles, and good morning. As Dr. Eccles said, my name is Jamie Driver. I'm the Executive Director of the Independent Schools of St. Louis. We have 43 member schools throughout the greater St. Louis region. They are independent and private schools that range in age from preschool or even younger, toddler, all the way up through grade 12, and every kind of school imaginable in that mix. We do have currently 6 schools in the city of St. Louis that represent about 1,300 students. And it has been incredibly helpful and a real opportunity that we've had to work with Dr. Eccles and the city Department of Public Health, as well as with our other school partners in the city. This has been really a unique opportunity that has brought us all together. And I think we are really recognizing the value in being able to talk with each other. These are groups that traditionally have not spent much time talking to each other. We tend to function a little bit in our silos, but this has really shown us the power of partnership. In terms of our work within the schools, the minute that everything started to happen last spring, we were approached by Dr. Eccles and the mayor's office actually to come together and form this working group to work together to figure out how we can move through this and put the strategies in place to keep our schools safe. And we have continued that. We meet weekly with Dr. Eccles. We get consistent information as soon as it becomes available, which we're then immediately able to pass on to our schools. But it was with Dr. Eccles' guidance and the city's advice that really helped us maintain our ability to stay in school. Our schools remained, went virtual, of course, in the spring, as everyone did. But throughout the summer, we worked with the Department of Health to really put our mitigation strategies and plans in place such that our schools actually opened on time in August. And our schools have been in person largely throughout this pandemic because of what we've learned from Dr. Eccles and our working group. Our mitigation strategies, while it was bumpy at first as we put them in place, have proven to be incredibly effective. And I'll just echo what Dr. Eccles said, our schools have seen very low transmission between students. Anytime we've had outbreaks in our schools, it has oftentimes been as a result of activity outside of the school that has come in to the school after a gathering or a party, or certainly after the holidays, or it's been teacher to teacher, so adult to adult, not student to adult. And our schools have, as I said, maintained all of their mitigation strategies. They still do to this point: masking, social distancing. Every facet of the school day has been examined by Dr. Eccles, everything from pickup and drop off, strategies to quarantine protocol. And anytime we've had a question or a concern, we've had immediate response from the health department. And I just say it's been a stressful but very good experience in that we've seen the results of this work in place. And I again can't echo how incredible it's been to be a part of this community and to see all of the different kinds of schools coming together. And it's our hope that we can continue this even once the pandemic is behind us, to continue to work together, because we're all working on behalf of all the students in the city of St. Louis, no matter what kind of school we are. So it's been, as I said, I can't say enough about Dr. Eccles and his team and how helpful they've been to us.
Thanks, Jamie. Next we'll go to Doug Thaman, who is with the Missouri Charter Schools.
Thank you, Dr. Eccles. My name is Doug Thaman. I'm the Executive Director with the Missouri Charter Public School Association, and the charter schools that are in the city of St. Louis are members of ours, and we work on their behalf. We have 33 public school buildings in the city of St. Louis, serving students from pre-K through 12th grade, approximately 12,000 students, approximately 2,000 staff members, serving 8,000 to 9,000 families. And I echo very much the sentiments that Jamie shared, the exceptional work that Dr. Eccles and the City of St. Louis Department of Health have done. It's really been, it's been really, truly terrific work. As Jamie said, in the spring of 20, when this began, we immediately were brought into daily, sometimes 2 or 3 times daily, briefings with Dr. Eccles, with the health department and the mayor's office. Lots of good opportunity for discussion and planning. And from there, our work together really fell into 3 buckets: information, operations, and education. In the area of information, that's been very consistent and continued on with daily updates that we receive, school-age youth health reports. Our group meets on Wednesday mornings, every Wednesday morning without fail, for updates and to talk about kind of what are the upcoming concerns, as well as just answering questions around mitigation strategies and helping with the logistics and the operations. Dr. Eccles, at the beginning, before the school year began, made himself available to come into schools, conduct school visits, walk through with the school leaders the mitigation strategies and how those could be implemented effectively in buildings. And that was of a great value because, as you know, every school building is different. And there are different pathways and different ways that students are pulled together or separated. And so that was really helpful. one of the other things about the mitigation strategies is that it was firm guidance that was provided to our schools. And I think that was really helpful because it gave a sense of confidence to our school leaders that they could provide safe school environments for their kids. The education area was also really important, doing a lot of education through printed materials, Facebook Live events, video, to not only to educate parents, but also to educate teachers and make sure that the information was timely. And then finally, the work that was done around the COVID testing. Dr. Eccles and his group worked with us very closely before the school year began, and we were able to coordinate with the FQHC's testing sites for 100% of our school personnel to ensure that they were all testing negative prior to the school year beginning. And between Jamie's personnel and St. Louis Public Schools, our 2,000 or plus teachers, that was no small feat, but the coordination was really very well done, and we were super appreciative of that. The work is ongoing. As Jamie said, it's been a unique opportunity to bring everybody together in partnership, and that's a silver lining of all of this, which is great, and we hope to continue that. While I have the microphone, I would just echo some of the concern I heard at the beginning of the meeting around concerns about equity of distribution of the vaccine. We understand completely that this is not because of the health department holding back vaccine or anything, but we do serve some of the most marginalized students and families in the state of Missouri, and we are really anxious to have all of our students back in the classrooms, back in school, and anything we can do to help with ensuring that there is equitable distribution and that our families, they're not left behind or they're not put to the bottom of the list. We are anxious to do that because it's just really important to have our students back in school. Thank you very much. Appreciate the opportunity.
Thank you, Doug. Next, we'll move to Dr. Brown with St. Louis Public Schools.
Good morning to all. A lot of what was said is taking place within St. Louis Public Schools. I am Dr. Brown, Deputy Superintendent of Student Support Services. And yes, since the beginning, Dr. Eccles has convened a group of educators within the city to pretty much have us form a partnership to work together as far as we did meal distribution and those types of things. So I think those things worked out well. But along those same lines, I thank Dr. Eccles' office for providing the training for contact tracing. We have our own contact tracing team within the district. The city health department was very instrumental in helping us go through the training that we needed. So we use our ER department and our one of our in-house lawyers to run our contact tracing team, which when a staff member is exposed, and they send an email to a specific email that we have within the district, and that generates the kind of conversation with the contact tracing team, which helps reduce the situations that we have within the district. So that's been great, as well as the weekly meetings. Sometimes we meet with Ms. Thomas and her team weekly to provide updates. The partnership with Affinia, as Sir Thaman said earlier, making sure that all of our staff members were tested early in the school year was really, really positive. And continuing with Affinia with our athletes. Our athletes are tested once a week. So that's very helpful with us. So the partnership has been really, really great for us. Dr. Eccles' office even provided some help with our antigen testing. Right now, we provide antigen testing within 15 schools within St. Louis Public Schools. And so along with that and a PPE order and the guidance through that has really been a really good partnership. I don't think we could have done this without, because we did not know all the nuances of what needs to be done. And so it's really been a great partnership, and hoping that we can continue this even beyond COVID-19.
Thanks, Dr. Brown. And then we have the Archdiocese schools. So Christy Mantic.
Good morning, everyone. My name is Christy Mantage. I am the regional director for this Catholic schools in the St. Louis City area. We have 16 schools serving children from age 2 through high school. The Archdiocese has 100 schools total. We go all the way south down to Perryville, all the way west out into Washington. And I will tell you, working through this, our partnership with St. Louis City Department of Health has been the role model and the standard for what people are trying for the Archdiocese, truly. What is being echoed here, we started in March along with everybody else going virtual with these 14 schools, meeting once a week, coming up with our own task forces at the local level, figuring out mitigation strategies, talking, weekly to try to get our schools open. We opened 14 out of the 16 schools in person starting in August. Some of them hybrid, some of them 5 days a week. It has been, I met with my principals yesterday and somebody said, it is both a marathon and a sprint. And I thought that is true, because it is the end of the line, but it is also this daily changing as you're going, right? You're building the ship as it's going. What has been the most remarkable for our schools is the relationship building that we have had with the Department of Health. So not only Dr. Eccles, but a lot of people that are on this call. Specifically, I would like to say something, just a shout out to Suzanne Alexander. She has been our point person. She was invited to our meeting yesterday with our principals, and that ability to have a person to call has really made the difference on how we're able to walk through this. Currently, right now, I have one school that's learning virtual because for the next 2 weeks, and that is a staffing issue, right? Because we had a positive person on the staff and then the contact people from that, we didn't have the supervision, right, to be able to stay open. I think I have 9 other cohorts out, classes out. But other than that, we are in school and learning. And again, it really is about that trusting and positive relationship that we have built with the City Department of Health. So we are grateful and echoing what Dr. Brown had said, we're hoping that this partnership will continue as we move through here. So we're very grateful for the partnership and the relationships that we've built.
Thank you, Christy. And so we've covered the primary and secondary schools, but we didn't want to leave the tertiary academic institutions out. So we've had the pleasure of working with Drs. Hammer and Redmond, which is WashU and St. Louis University. And so we'll start with Dr. Terry Redmond.
Thank you. I'm actually going to share a very, very brief slide set that kind of talks, again, very, very briefly about what happened with SLU this fall in our partnership with the City Health Department, for which we are extremely grateful. I believe that collaborative relationship is one of the reasons why we were able to open and stay open successfully the entire fall semester. So this slide just lists all the safeguards that we implemented in fall of 2020 on our campus. And I'm sure many of these look familiar to you that are in K through 12 schools and WashU as well. But it's important to note we partnered with the City Health Department in development of all of these plans. All of our decisions were based on CDC guidelines that existed and information that was released from the city and county health departments. But as many of you know, there were a lot of areas that there was not specific guidance about decisions that needed to be made. And so those decisions were made in partnership with the health department. So for example, there weren't great parameters around how to decide how much to de-densify campus. And in some ways, universities are very different than K through 12 schools because our students, or many of them, live on campus. So we have congregate housing, and that poses a different infection risk during pandemics. So for many of those decisions, we worked with Dr. Eccles and his team at the health department in making decisions again about how to open and stay open as safely as possible. The City Health Department has been incredibly supportive and collaborative in our planning. And I'm not going to talk about all the ways in which they've helped us, but I just want to give just a few short examples. Over the summer, Dr. Eccles was gracious enough to visit our campus and actually did a tour of our on-campus housing to discuss our de-densification plans. During that meeting, we also sort of overloaded him with other information about our plans and a whole line list of questions that we had about all of our protocols. And he was very gracious to provide feedback on all of those that did help us decide about our public health safeguards for campus. We did develop our own internal contact tracing team. That team works very, very closely with the City Health Department's contact tracing team. They meet weekly, and it's a very collaborative, synergistic relationship, and we really appreciate that. Dr. Eccles and his team meets regularly with our student athletic group as well to help inform our asymptomatic testing protocols for athletes, their quarantine procedures, our response plans, and reopening plans for Chaffetz Arena. And then one last example, the health department intervened very rapidly in the fall when we learned about social gatherings at city venues in which mask protocols were not being followed. And that really did help us to stay open this fall. I just wanted to mention SLU was one of the first universities to post our COVID-19 infection data online. We have had full transparency throughout the pandemic and plan to continue to do that. And our data is based a lot on similar data that's being reported with the city and county health departments. We offered both symptomatic and asymptomatic testing through the university. We conducted about 1,700 symptomatic tests and about more than 8,000 asymptomatic tests. So more than 10,000 tests overall this semester. And we plan to keep the same testing protocol in place. So we test anybody who's symptomatic, obviously, and then we have a very robust asymptomatic testing plan. We test all of our on-campus students when they first show up for the semester, so at the start of the fall, and we start tomorrow with the re-entry for spring semester. So we'll be testing all of our on-campus students again tomorrow, moving through next week as they move back to campus for spring semester. And then throughout the semester, we conduct a 10% random sample of our on-campus students to keep an eye on our asymptomatic positivity rate and identify any clusters that might be happening on campus. Our positivity rate from asymptomatic move-in testing was 0.6%, so extremely low. And throughout the semester, our positivity rate, the average was 3.9%. So throughout the entire semester, our positivity rates were significantly lower than what we've seen in St. Louis, in Missouri, and actually across the entire United States. So campus stayed very safe. Very briefly, this is the picture of the data of our COVID-19 infections among our students this fall semester. And when you look over the entire fall semester, you can see we did have an increase in cases that mimicked what was happening in the city and across the United States as we moved into the second wave of the pandemic. When we actually looked at the data, it turns out that this was tied to that very first cold weekend in St. Louis. And then the most notable jumps were related to the fall break, which our fall break was only officially 1 day, but students made their own fall break and they traveled home. And our contact tracing team determined our students were not getting infected on campus during fall break. They got infected from their parents and family members when they were home visiting and actually brought the infection back to our campus. And then our largest increase in cases happened after Halloween, when we saw a large number of parties and social gatherings that happened that weekend. And then we saw the outcome of those parties. But our rates started to come down after those Halloween parties had ended and actually stayed really low for the remainder of the semester. And we only had one student with COVID who required hospitalization throughout the fall semester. And that student did have multiple underlying issues that put them at increased risk of severe disease and outcome. Our contact tracing team, as I mentioned, worked very, very closely with the City Health Department, and we really appreciate that collaborative relationship. The information that we gained from our contact tracing team found that disease transmission was associated with students living together. So they were roommates, they were romantic partners, or they were in the same social gathering without wearing masks. It's important to note that we tracked our data very, very closely, and we did not have a single documented case of disease transmission in any classroom or lab space anywhere on our campus throughout the semester. And then lastly, we did have a very successful fall semester, so our plan is to continue our protocols. with the exception that we have done a lot of debriefing over winter break, and we are examining our lessons learned and making some changes in our spring protocols to be in line with that. And we look forward to continuing to collaborate with the City Health Department as we work through the remainder of the pandemic. And then just one final bit of good news. Yesterday, we were informed by the state we've been approved as a COVID-19 vaccine provider. So we plan to be able to, we're trying to order vaccine now with the hope of being able to administer that on campus and to our high-risk patients through SLU Care and our other clinics as we move through this pandemic. With that, I will stop sharing my screen. And I do appreciate being invited here today. Thank you.
Thank you, Dr. Redmond. And last but not least, Dr. Stephanie Hammer from Washington University. Dr. Hammer, you're on mute.
Hi, thanks for inviting me. It's nice to see everyone and be invited as well. I'm Stephanie Hammer. I am the Clinical Medical Director at Habib Student Health Services, which is WashU's student health clinic on the Danforth campus. We manage all the graduate and undergraduate Danforth campus students. We are officially, our campus is located in the county, but we also de-densified our campus. We have lots of students who live in the city. We have faculty and staff that live in the city, and our students also go places and often go to the city. We are a part of the city as well, and try to be a good partner. Last semester, we had just over 11,000 students that were on campus or near campus that returned for studies. Like I said, we handle the Danforth campus. We work closely with the BJC, Occupational Health, who took over the WashU services for the faculty and staff at Danforth. And then this fall, like everyone here, we pivoted into becoming a health department in addition to our clinical duties. So that was really something. Our campus is also de-densified, and they worked with the infectious disease specialists at WashU at the hospital to work out that plan. Our students arrived over Labor Day weekend, and it was at that time that Dr. Eccles reached out to us after noticing some positive city residents. We do perform saliva PCR testing on all of our students. We did, just like SLU, entry-level testing on everyone as they arrived. Our positivity rate last fall was I think we had like 2 positive out of the surveillance testing. So it was like it was a very low positivity rate upon arrival to campus. Thereafter, we do surveillance testing with the saliva testing on all of our undergraduates on a bi-weekly basis. So last semester, we ran over 32,000 surveillance tests, which was quite a lot. Our positivity rate over the last semester was 2%. So we also maintained our low levels. And we developed our own in-house isolation, quarantine, contact tracing, case investigation program. After Dr. Eccles reached out to us, we signed an MOU so that we have an agreement that we could do the contact tracing. And like many of you, we also got enrolled in the weekly meetings, which have been so helpful. I can't agree more with everyone who's already spoken before me that the power of partnership, opening up these channels of communication has just been phenomenal for us, and something that we haven't experienced with other partners. It's really been most helpful. Setting up a contact tracing unit with no experience, we really appreciated Ms. Thomas and the contact tracing group at City, who provided us weekly encouragement, emotional support, helpful tips and guidance about how to handle some of our difficult contact tracing experiences. And it's just really been fantastic. One anecdote I'd like to share is as we embarked on the isolation and quarantining of our students, We also, it fell during the election day in early November. And Dr. Eccles and his team gave us the contacts and told me who to call and who to email and set up introductions so that we were actually able to assist our students in isolation and quarantine to vote. It was really, really appreciated by our students, and we would not have been able to pull that off without our team resources. So really appreciate that. I think it's just been fantastic to be part of a group. There are other communicable diseases that we can continue to work on together. So I've really appreciated the partnership. Our students are returning now. We are performing entry testing again on all of them. It's required for our undergraduates.
Uh-oh.
Hey, we just lost her.
Yeah.
Yes.
But so they're doing some great work at Washington University, as everyone can see. And so the partnerships that have been established will continue. But within the department, there's a special group that has been really lifting a lot of this work. And so that's the communicable disease section. So as you all know, we were able to hire additional contact tracers, what we call public health program representatives, using the CARES Act funds. And we're also leveraging the community development and block grant funds, which were provided by HUD to hire these staff. And we want to make sure these staff were brought on not only for 6 months or through the end of December 2020, we want to make sure that we could keep them on through 2022. And so we've been able to hire some really amazing staff. And leading that group has been Ms. Franda Thomas, who's the Health Services Manager too with the City of St. Louis Department of Health. But we can't speak enough about not only her leadership, but also the leadership of the quality of the work that's being done by the staff that we've been able to hire over the last few months. And so we're really grateful for this opportunity to work more intimately with the academic institutions. It's really been heartwarming for us. And again, we want this to be sustainable. So it's not, we don't want this to resolve after the COVID-19 is kind of behind us. We want to make sure that these lines of communication remain open as we move forward, because health impacts all of us. And as the health department in the City of St. Louis, it's really our responsibility to make sure we're engaging community. And if we're not engaging academic institutions, we're not engaging community. So we want to make sure that we continue to work closely with the primary, secondary, and tertiary academic institutions well beyond COVID-19. So, and Dr. Hammer, we lost you, but we see you were able to join us back. Thank you so much for that update.
So Dr. Eccles, that was outstanding. I see the recent article from the New York Times about tracking COVID cases nationally. I really do think it's important that we take this data both from the high school level and the college level and really get this in the public domain as quickly as possible. I know there are probably some media entities on the call. I think it's important that we write this up almost as a morbidity mortality weekly report, kind of a CDC type of a story, and really get this published. People don't know what's done if we haven't published this. So we in public health don't always like to toot our own horn. We reside on improved community health as a testament of what we've accomplished. But in cases like this, I do think it's important to write this up and to get this disseminated in the appropriate forums.
And thank you, Dr. Ross. And I 100% agree that we need to share this good news. And I believe this also may tie back to some of the concerns about equity, and that some of these school districts are serving the families that we are concerned about in terms of getting COVID and also getting the COVID vaccine. And perhaps this could also be an avenue of reaching some of the families. This partnership with the schools can be an avenue in reaching some of the families who we would like to be fully informed about getting the vaccination to address some of the equity issues. But this is definitely excellent news and a really outstanding partnership that we need to advertise and make sure that the community knows about and leverage for building an equitable distribution of resources and of vaccinations. Do we have any other questions from the panelists or any comments? Thank you to all of the panelists and all of the representatives of the different educational institutions. Thank you for coming and presenting and speaking with us about your experience and working with the City Health Department. And again, kudos to Dr. Eccles for coordinating the panel of school executives and for convening all the schools to make sure that we keep our youth in St. Louis safe. So we will move on to the next agenda item, which is also Dr. Eccles. It's COVID-19 business closure updates.
So as you all know, the health department, we've been monitoring compliance with COVID-19 restrictions in the city of St. Louis. Non-compliance has led to closure for several businesses. The most recent count, at least I'll talk about this week, we've closed 6 businesses this week for non-compliance. And so we are, we want to make sure that the community knows that we are serious about protecting their health. The mitigation strategy that we are, that we're requiring in the city of St. Louis, particularly for businesses, are not new. So a lot of these restrictions have been in place for several months. And so some businesses are doing an amazing job. So we actually have a secret shopper program that's up and going now. And so they provide feedback on individuals when they go into an establishment. If they're required to wear a face covering, they let us know. If there's social distancing that's happening, they let us know. If they aren't required to wear a face mask, they also let us know that. So they're providing really good feedback for us, and it gives us an opportunity to work more closely with businesses in the city of St. Louis. But we also ultimately want them to understand the intent, which is to protect the health of our community. However, as we have moved through the pandemic, there has been some resistance. And so right now there is an effort in Jefferson City. There are several legislative documents or Senate bills that have been created. And the purpose of those bills is to limit the authority of public health departments. Meaning, and it's everything ranging from food safety and control to penalties for non-compliance, really handicapping the health department's ability to do its job and enforce required regulations that are necessary to protect the health of the community. So there's a list, there's about 6 or 7, maybe even more Senate bills that have been presented, and so I'll send that list out to the group. But we're following that really closely with the Missouri Center for Public Health Excellence. They have a legislative group that's following that as well, and so they'll be providing us with updates. But limiting the public health department's authority during a pandemic and even beyond a pandemic could create really dire consequences for our community. And so the regulatory arm for the health department is typically the environmental health branch, because they are responsible for inspecting establishments as well as enforcing national regulations. And so if we're not able to enforce these requirements, it really, again, it can cause a lot of harm to our community, and we just can't afford for that to happen. And so again, the Missouri Center for Public Health Excellence is following all of these Senate bills that have been presented. And I'll send this list out to the group as well, and provide an update as we receive more information from Jefferson City.
All right, thank you, Dr. Eccles. So kind of addressed the business closure and the policy discussion. Do we have any questions about any of the regulatory issues or business closures? Any questions from the panel or from any attendees, or any comments?
Dr. Blue?
Yes.
Yeah, just on that last comment that Dr. Eccles made about the legislation in Jefferson City, I have to say that given the totality of what we heard in this meeting, if you start from the very beginning where Dr. Eccles told us how good our numbers are doing in the city, the cases are going down, our positivity rate is going down, you know, some of the efforts that have been going on in the city and the county, put them in the group as well. Our region's been fighting this harder than everywhere else. And then we heard about what the schools are doing, the universities, to then hear that the state is, and then we heard about problems with vaccine distribution at the state, sort of tying the hands of the city and the county, making it more difficult and actually, frankly, inequitable at the city and county level. To then hear that the state is going to tie the hands further, is thinking about it at least, of tying the hands further of local public health departments. It's just disturbing, frankly, that would even be considered, because what we know, what we're hearing is that local public health control is working in this region, and that message should be delivered. We know it's working in our region. So we saw the story in the paper this morning about this, and I share Dr. Eccles' concern about this, and I think we should continue to monitor this, and that is not the direction we should be going.
Dr. Ross, did you have a comment?
No, I was just simply saying amen to Professor McBride.
Yes, thank you, Dr. McBride, and continuing to go back to the health equity issues. You know, the equity issues, while they're pervasive in the U.S., they are contextually specific and unique to our region, to St. Louis, and so we, you know, as public health officials, need to have the latitude to be able to make decisions that are reflective of our local context, and to have our hands tied any further will have an effect on the community and on the health of the people of the region, and could exacerbate health equity issues that are locally contextualized and that need to be dealt with on a local level, with an understanding of history and what the local community wants. And so it could be devastating and really exacerbate the equity issues that we're fighting so hard to get rid of, because the equity issues are not uniform across the state, and losing our ability to make decisions that are contextually appropriate and best for the characteristics of our communities and our populations that have been disenfranchised uniquely in St. Louis, and the region could be problematic. And so I think some understanding, you know, of that issue, you know, back to the state, that, you know, we have to be able to make contextualized decisions that are responsive to our the unique characteristics of our community would be necessary.
Yeah, my only comment, Madam Chair, is that when we do this, I appreciate Craig just sharing some information. Craig Schmidt just shared some information. I want to make. I hope that we can do this in a regional approach, the city and the county jointly. Legislators do respond to calls and letters. I know that personally, and so you know, a regional response could go a long way.
Yeah, I do think this should be in collaboration with the county, so we could certainly discuss next steps in how we want to respond in a unified way, so we can make the best decisions for our region. Any other comments? I think we should reach out to the representatives of the county and the Spring Schmidt and the county board chair to see what needs to be done in response to this. Any other questions or comments about that agenda item? Thank you, Dr. Eccles, for bringing that up, and Dr. Ross, and thank you, Craig. Please, everybody, look at the chat. Craig Schmidt is putting in some helpful information that gives a little bit more context and some understanding of the issue. So we just have a few more agenda items. New business. The only new business that I have is that we will be having a board orientation next Wednesday. Dr. Eccles, we need to get some information out to the board. Hopefully everybody has that on their calendar, and that will be January 27th at 6 p.m. Any updates about packets going out in the mail, Dr. Eccles?
So the packets should be in the mail this week. And so the packets are for the second phase 2 of the board orientation, where we talk about the legislative requirements and the charter requirements based in the city, as well as the information that's been provided by the state. So that's for phase 2, but for phase 1, that will entail the board becoming more familiar with the activities and programs that are being implemented by the City of St. Louis Department of Health. And so this will be a presentation provided by all of essentially the executive leadership team at the City of St. Louis Department of Health. And that is the first session, which is scheduled for next week.
So everybody, please, thank you, Dr. Eccles. Please mark that on your calendar, board members, that we will be having phase 1 of our board orientation at 6 p.m. on Wednesday, the 27th. And the board packets will be for, if you get them beforehand, it would be nice to start to look through them, but those will be for our second phase of the orientation. But for the first phase, please read through the strategic plan for the health department and some other information you get via email. So please let us know if you're unable to make that 6 p.m. time on the 27th. And we're looking forward to getting together and making sure that we are operating the best way possible as a board on behalf of the city. Any other questions or any other new business?
Dr. Ballou?
Yes.
I was wondering, I know that just one other matter, things we haven't touched on so far are any forms of financial relief for both the businesses and citizens of the city of St. Louis. I know we had spoken last time about the fact that Judge Burleson had extended his order granting evictions relief until the end of December. And I think I remember seeing that he had extended that to the end of January, but I'm not entirely sure. I'm just wondering if we know if he's handling that sort of on a month-by-month basis. And also I'm curious to know what the status is of any remaining CARES Act funds that might be distributed to assist any of our city businesses or any other financial relief that may be provided to those individuals or organizations in need.
So I can speak to that a little bit. So the CARES Act funding, so the initial deadline for us to spend down all of the funds that were released by the federal government in 2020, the initial deadline was December 31st. And so we treated that as our real deadline. And so we worked really hard to spend down those funds. So the health department, we spent, I want to say 100% of our allocation by the deadline. There was some money that's still being used for, I believe, mortgage and rental assistance and maybe temporary housing. But other than that, the bulk of the funds that were allocated to the city of St. Louis were spent. So right now and we didn't receive information about them extending the deadline until, I want to say, the last week in December. And so by that time, all of the funds were essentially accounted for. But we are having discussions about priorities that need to be in place for this upcoming funding that we'll be receiving probably in February. And so providing incentives and resources for small businesses is a priority. And so we're working with other government agencies, particularly St. Louis Development Corporation, as well as other agencies to make sure that there is a pipeline to get funding to small businesses in the city.
Thank you, Dr. Eccles. Thank you for bringing up that question. And I think that we could perhaps have some discussion on that issue, since the second round of CARES money will come in February, and we can discuss that a little bit more at the February 4th board meeting to get some details and to see how our community members and small businesses will be supported financially, and to get an update on the evictions. And I will make that an agenda item specifically at the February 4th meeting.
Great, thank you.
Thank you. Any other questions?
I think there was a question, Professor McBride mentioned that someone in the guest room who had a question. So you, as chair, you can recognize those questions if you choose to.
Okay,
There's a person named D. Arnold who has their hand up. I don't know if they meant to raise their hand or not. I'm not sure how we turn them on.
So for D. Arnold, who's in our attendees list, would you, if you have a question, would you put it in the chat, please? That would be helpful.
Hi, yes, can you hear me?
Oh, yes, we could hear you. Thank you.
Hi, this is Damon over at KMOV News 4. I just had a quick question on if we knew what the 6 businesses were that were closed down. I know 2 of them, one was the Wheelhouse and the other was Star Bar, but I didn't know what the other ones were and didn't know if you had that on hand.
If you can submit that particular question to our public information officer, so you can send the email to health@stlewis-mo.gov. We'll get a response back to you.
Okay, I thank you so much.
Mm-hmm.
Thank you for your question. Okay, our next agenda item, we are going to move to committee chair reports. So first, the Governance and Nominating Committee.
So hello, I guess our committee ranks have dwindled. We lost Dr. Swingle from our committee, and Dr. Ballou, of course, has stepped into a new role. So our Governance and Nominations Committee would be interested in having new members join, any of our new members join our committee, especially those who are interested in promoting diversity and equity among our ranks. We do have all board seats filled right now. So we're not immediately looking for board members, but there's always a fair amount of turnover. And so we'd like to keep new board members in the pipeline. So if you have names or nominations, you can send them to Dr. Ballou or to me or to my fellow committee member, Paul Lee. The other, I think, long-term issue that we have on the horizon, and this will be familiar to Dr. Ballou and certainly to Dr. Ross, is that we do operate under the city charter, which still maintains provisions that call us the St. Louis City Board of Health and Hospitals. And of course, the city no longer operates any public hospitals. So at some point, we might want to speak to the city councilor's office about updating the charter to be a little more accurate in its provisions. So, but that is, I think, a longer term objective for the committee. But we have not really taken active steps to proceed on that longer term project. And I think that's it for now.
Thank you for that report. Hopefully by our next meeting, if we could have our current board members that are interested in serving on the governance committee, if we could have you contact Linda, that would be great, because we'd like to get that committee fully staffed again. So hopefully by the 4th or the next couple of weeks, if you could please express your interest and via email, so we can fully staff that committee, so we can make sure governance committee duties can continue to move forward. So thank you. Any questions?
Yes, I do want to point out to the new members that they have to join one of the 3 committees. It's not an option. So if they not choose one of us, or it has to be one of the 3 committees. So please think about which committee that you want to join, and just sign up for that.
I want to thank Dr. Lee for that statement. That is true. We made that request a requirement of the board, and after a certain time will be the responsibility of the chair then to appoint board members to committees. So, but we would prefer to have board members choose beforehand.
So I will send out an email to the board with all the committees. If the different committee chairs could let me know which committees are short-staffed, I'd like to get that rectified by our next meeting, so that by February 4th we have fully functioning and fully staffed committees. So I will send an email to that effect after we close this meeting, so we can make sure that everybody is serving on a committee and that everything is in order. So any last questions, comments about governance and nominating? Thank you. All right. Academic Public Health Collaborations Committee. So Craig.
Dr. Ballou?
Yes, Craig.
Yes, sir. Yes, Craig.
Yes, so you and I have had a conversation, and doctors Darcy Sharp and Pam Exavarius are prepared to update in a very short way for, I believe you said 10 minutes, or yes, with 5 slides for what's going on with the Academic Health Department, which is the Missouri Foundation for Health. Obviously, that doesn't include all of the other great institutions in our region, but it'll give you a taste of some of the work that's been going on, particularly as it's been impacted by COVID.
All right, thank you for that report. So we will have the Academic Health Department, the leadership from the academic institution to present and let us know what they've been doing and how they've been helping to address COVID in a report. Yes.
Hey, Madam Chair, I would volunteer for the Academic Committee, Public Health Committee.
Wonderful, thank you. Because part of the goal is to expand the Academic Public Health Committee to include all of the universities that have an interest in public health and the well-being of our community, which is pretty much most of the universities in our region. So that's one of the goals. I know Dr. Eccles has been advocating for that. So we do have a funded academic health department between St. Louis University and the city and the county. But we need more of an all hands on deck approach. And we would really like to get some collaborations between and within all of the other universities and the health departments in the region. So thank you, Dr. Ross. I'm going to, I was going to say pencil you in, I'm going to pen you in in a more permanent form and make note of that. And we will proceed with staffing the rest of our committees after as part of our orientation activities on Wednesday. So thank you, Serena, for mentioning that we could staff our committees after the orientation. So we will make that kind of the end of an orientation activity and have people sign up after that. Any other comments? If not, we will move to the Health Communication Committee.
Good morning. I believe we're in the process of scheduling a meeting, and we also could use at least another member to add to our committee. We've lost one, I believe. So.
Well, thank you. So we will make note of that you have a committee space, and we will address that at orientation as well. So any other questions? So it seems like we have some great ideas with making sure that we do the orientation so people can be selective and informed about which committee they will participate in. So we will have a committee overview as part of our orientation on Wednesday, and people can sign up for their committee after that. So we still hope to get our committee staff before the next board meeting, because our orientation is next week and our next board meeting will be February 4th. So we can still make that timeline, but we will wait until orientation to make sure that everyone's fully informed about the duties and functions of each committee. So our next business item is department updates.
Well, I think we've shared a lot today. So what I'll say in short is that the health department is really busy. So in addition to COVID, we understand that COVID is one issue that we're dealing with, but there's a lot of other public health issues that the health department is responsible for addressing. And so we're trying to make sure we don't lose any traction in addressing those other issues. And so our partnerships that are being developed are being developed not just for COVID-19, but for public health. And so as we move forward, there's a lot of other activities that are actually underway. So for during that upcoming meeting in February, there'll be some health department updates around health equity. There's some public health briefs that have been developed by our epidemiologist. So we'll be having one of the representatives from the epidemiology team present some of their data and findings. In addition to that, we'll have a presentation by Ms. Amanda Holmes on what some of the steps that the health department is taking to address health inequities and racism internally. So one of the things that we understand is that we have to do the work internally first if we're really serious about having an impact in our community. And so that work started several months ago. And so we'll be using this opportunity, using the next meeting to provide you all an update on where we are and where we're hoping to go in 2021. So that will be the Cliff Note version of the health department's update for today.
Thank you, Dr. Eccles. So that is essentially our one of our last agenda items. We have old business and announcements. I do not have any old business, but are there any announcements from any of our panelists? Is there anything going on in the community or with the organization that you represent that you would like to tell us about?
I just wanted to share and to let folks know, if they're not aware, that the VA hospital has started vaccinating veterans and with specific populations being prioritized, the elderly and certain immunocompromised folks. If there's an interest in seeing what their rollout is, and also I will be assisting them with some vaccine messaging. I just thought that was of interest given earlier conversations. I know this goes without saying, but want to make myself available to Dr. Eccles if we need to be thoughtful about some of the communication strategies we talked about earlier on the call. Your team and you have done tireless work for the city, and I just want to commend you on the record. Thank you.
Thank you for those comments. We'd certainly like to hear an update at our next meeting about how the vaccine rollout is going for our local veterans. So please update us about any lessons learned or from the VA vaccine rollout. And yes, I will second that commendation for Dr. Eccles and his team for leading the city through an incredibly trying time with excellence and grace. So thank you. Are there any other?
One quick update. So just to piggyback on what Dr. Lachwell Davis mentioned. So I had my first call with the chief of staff for the VA yesterday, actually. And so we're looking at opportunities to partner, because we realize that, we have to leverage resources across these different agencies. And so those discussions are ongoing. So we're looking to get their final decision, the executive leadership team for the VA's final decision on what this partnership should look like. And so we'll let the team know about that as well.
Dr. Eccles stays on the ball. Thank you, Dr. Eccles.
Thank you. Do we have any other comments or announcements or any community events that we should be made aware of? Any?
Dr. McBride.
Dr. Ballou, if I could.
Yes.
I just want to give a shout out to Dr. Manny, who for her communication as well. I think she's become one of our media stars in the community. I've seen
International.
International, national, international. So, and you know, so when we're thinking about communication strategies, I think we should turn to her. You know, and I've seen some videos of your daughter and kissing the screen and all that. So, you know, I think we, you know, in all seriousness, you're doing a great job of that. And, you know, I think we have many people on the screen who could do a great job in this communication strategy. We have some serious challenges going forward. We heard some of this in the meeting today about as we were all at the vaccine strategy to try to reach numbers that we're going to need to reach. You know, Dr. Manny, Dr. Ross, others, Dr. Eccles, all of us in this room can, you know, help us when we move from 1B to 2 to try to, you know, knock down some barriers and misunderstanding about what the vaccine's all about, because we need to tackle this to get through 2021. So I commend Dr. Davis and others in their work.
Yes, amen to that. We definitely have a media rock star, CNN, BBC. So yes, Dr. Davis has been representing St. Louis very well on a national and global scale. So that's, you know, definitely deserves a round of applause. Thank you for that shout out. Any other announcements? Anything in the community that we should support, or that any events? I mean, I encourage all of us to kind of get out there and go to whether it's virtually attend in a safe, socially distanced way, community events, so that we actually know firsthand what's going on in the community and understand the individuals and the families that we're serving. So are there any other community events or anything else that we should be made aware of that we can attend, or that so we can continue to support the citizens that we serve? Anything else we need to know? All right, so I believe that, and there are some, so please take a look in the chat box. There are a number of really excellent resources that have been posted by our board members and our panelists on you know, vaccine distribution and communication. And so, you know, please cut and paste those, and we'll make sure that, you know, obviously we're going to save the chat, but just take a look at the chat. And thank you to all of our panelists and attendees who are giving information via the chat and keeping us informed about current news stories. So we are at 9:30, and if there are no announcements, I will move to adjourn this meeting, and we will reconvene on February 4th. And if anybody has any questions or agenda items that are pressing, please send me an email. And otherwise, I will see the board members on January 27th for our part 1 of our board orientation, and we will see everybody on February 4th. So I move to adjourn the meeting. All right. So thank you everyone for your time and your commitment. And again, shout out to Dr. Eccles and all of the staff and all of the board who are keeping us moving through this pandemic. And have a safe day, and stay healthy until we meet again on February 4th. Thank you so much, everyone.